All right, you're live and host. I'm signing off.
Good afternoon, everyone. Welcome to the Calhoun County Joint Information Center virtual meeting for Wednesday, January 19th, 2022. Next slide, please. Please take a moment to review our administrative notes. And our unified command team, Kelly Scott, Calhoun County Administrator Controller, Rebecca Fleury, Battle Creek City Manager, Eric Pessel, our Health Officer of Calhoun County. We have an additional speaker today, Dr. William Nettleton, our Medical Director of Calhoun County Public Health Department. Next slide. Our Joint Operations Center lines of effort and priorities. Purpose of our Joint Information Center. Please take a moment to review that. And on to our agenda. First up today is Mr. Eric Pessel with our countywide COVID situation report. What do you have for us, Eric?
Thank you, Chris, and good afternoon, everybody. So the update today is going to be a little more, I guess, bad news than we had even the last time we spoke at the JIC. Unfortunately, we're in the middle of the largest surge that we've seen since the pandemic began. You can see on this graph, this goes all the way back to March of 2020. And you can see here right on after the new year, when Omicron became pretty much the variant, I guess the variant that we are seeing the most, when that became or came to Michigan and specifically Calhoun County, we saw our numbers jump considerably, our number of cases. So we're now topping out at just over 25,000 cases since this pandemic began. Currently, we have 42 COVID patients in our 2 hospitals, and our deaths now have reached 474. But the right side of this graph is what I want to point out. And you can see where just today, in the last 24 hours, we did report 345 cases, and you can tell that that's the most we've ever reported in one single day in Calhoun County. And just like other jurisdictions around us, around the state and around the country, that's what we're seeing right now is a lot of cases and a lot of disruption. Next slide. This kind of points out to you in a little different way As we track since September, excuse me, this past fall, the incident rate per 100,000, and that's a 7-day. The incident rate is over 7 days, and our percent positivity rate since September, you can see where we just continued to climb until now. That week there in January between the 5th and the 11th, and I can tell you it's even more this past week. We've jumped up to over 1,000 cases per 100,000. And our positivity rate is over 33%. I can remember us talking, oh boy, it's probably been over a year ago. Maybe it was last summer when we talked about, we want to get our positivity rate below 3%. And that's when we know that we've got this virus, whooped. And right now it's in our community. It's disrupting our lives. We're going to talk about that a little bit more. And you can see basically out of everybody that's getting tested, and this does not include home tests that don't ever make it to the system. These are tests that third-party folks that have to put the result in the system. Out of every 3 people that are getting tested, 1 is coming back positive. Next slide. So currently our recommendations, and that these really haven't changed, although they get tweaked every now and then, depending on what we're seeing. And with Omicron, we definitely know that those folks that have been boosted are, if they are a breakthrough case and they do become positive with the Omicron variant, we're seeing a very mild disease. Basically cold-like symptoms. So we still recommend that everybody 5 years and older get your primary series of the COVID-19 vaccine and receive a booster when you're eligible. Keep your physical distance at least 6 feet from others, even if you don't appear to be sick. Avoid crowds and close contact. Wear a properly fitted mask when physical distancing is not possible and in poorly ventilated settings, especially indoors. Wearing that properly fitting mask that just covers your nose and mouth can do just, even if it does a little, it does something to protect you and protect others. Clean your hands frequently. And then if you need to find a COVID vaccine or a booster, you can search on vaccines.gov. You can text your zip code. You can call 1-800-232-0233 to find the closest location to you. Please, if you haven't done so already, get vaccinated. Next slide. So recently, just a quick update on where we're at in Calhoun County with quarantine and isolation guidance. This came up, the CDC changed their guidance several weeks ago, I think maybe 3 weeks ago. And of course, Calhoun County, we took a look at that, took a look at what the state came out with, and put out our own guidance for both general population and our pre-K through 12 school districts here in Calhoun County. And you can see those on our website under general population or K through 12 staff and student full guidance. Basic changes, I'm not going to get into the nuances, but the biggest change was instead of isolating if you're a positive for 10 full days, you now can isolate for 5 full days. And if your symptoms are resolving, which means they're vastly improving, or you're asymptomatic, then on day 6, you can return to work or school. And the same way with quarantine. If you were exposed and known exposure to somebody that was a COVID positive, rather than staying home a full 10 days, you just stay home through day 5. And on day 6, you can return to work or school. And those are the biggest differences. There's a few others, but those are the 2 main ones. Next slide. And I'm going to turn it over to Dr. Nettleton.
Good afternoon, everybody. So the next couple of slides. First, talk about masking. Indoor masking continues to be very important to help reduce the spread of COVID-19. We know the Omicron variant is the predominant variant in Michigan, Calhoun County, and we know it's much more infectious. So both Calhoun, state of Michigan, and also the CDC recognize this, and therefore we need to change our strategy in terms of both mitigation measures, and that includes masking. So for example, you'll see the graphic on the right. So we know that an N95 mask, KN95 mask, can filter more virus, also other types of bacteria as well, and is more protective than a surgical mask, which is more protective than a cloth mask. And so we hear the announcements that the Biden administration, for example, as well, is going to be distributing N95 masks throughout the country. This is another illustration of how those different gradations of mask offer more protection. A key point is a well-fitting mask. That's what's really key as well too, to make sure there's not gaps on the side of your cheeks or kind of right above the nasal, or your nose meets your face as well. The well-fitting mask is very important. So this is a reminder of these different qualities of masking. Next slide. Yesterday, the federal government announced that the COVID-19 website for free home antigen tests is now live. And you can go to covidtest.gov and order 4 tests for your own household that ships in about a week or so. And so it goes to the United States Postal Service to arrive at your house. I happened to log in yesterday afternoon and already ordered my household's home test. Next slide. So just a little more comment about rapid antigen tests. These are the types that are included in that federal response. It's also the type that the Calhoun County Public Health Department has been working with our local school districts to distribute the schools and to parents as well. So these are quick 15 to 30 minutes turnaround times of at-home nasal swabs. You swab your inside of your nose, oftentimes on both sides. And if it's positive, it is highly likely that you have a current infection with COVID-19. I often hear a lot, well, should we confirm with a PCR test or molecular test if I have a positive antigen test? Really not necessary. If you have symptoms, you've been exposed to someone with COVID-19, and we know that COVID-19 is just so prevalent right now that if you're positive on a rapid antigen test at this point in time, you have current COVID-19 infection. Now, if it is negative, particularly if you have symptoms or after an exposure, consider retesting with an antigen test or a PCR test 24 to 48 hours after that initial test. Not enough time may have gone by for the virus to be detected, or how the inside of the nose was swabbed can affect the test result too. So you can use these rapid antigen tests with or without symptoms. And if you do use it when you have symptoms, it's best to use it in the first 5 days of symptoms. And the sooner you do it after the start of symptoms, the more accurate it will be. So it's really important to be testing right now. So you saw how high the positivity rate is in Calhoun County. That's really a reflection that we are not detecting a lot of virus, and that we need to be doing more testing. That's what I encourage us to think about, that high positivity rate. That means there's more virus that we're not detecting, and we need more testing. And more testing helps us reduce spread. It informs folks to isolate if they're infected, quarantine if they've been exposed. And the sooner we know that you're infected with COVID-19, the sooner your doctor and yourself can get you into treatment. Another important reason for why rapid antigen testing and testing in general is essential right now. So next slide. So Calhoun County is a part of an initiative with the state of Michigan, and Homer Public Library is distributing home rapid antigen tests, 1 kit per person, up to 5 per household. So we are one of a limited number of libraries in the state of Michigan to be part of this program to distribute home antigen tests. And so you can see where the Homer Public Library is located and what the hours are to go pick up a test kit at this library. Next slide. And just to piggyback on those other mitigation measures, so we've talked about how important vaccination is. Also boosting. Boosting, we know, further protects from infection and really reduces the risk for hospitalization amongst those who are vulnerable. We talk to our hospital partners. They share with us that less than 1% of folks who are COVID or who are hospitalized for COVID-19, less than 1% of those patients have been boosted. In other words, the people who are ending up in the hospital are those who have not been boosted, and particularly those who have not been vaccinated. In addition to that, I mentioned masking too. And the third part of it, besides testing, is avoiding large crowds, avoiding large gatherings. We know when folks are close together in close quarters, increases your risk of being exposed to multiple people who may be infectious at the same time. So the state of Michigan has put out a guidance to avoid large gatherings at this time, if possible. Next slide. So I wanted to transition also to the new treatments for COVID-19. So the picture here shows the spectrum of illness from not being sick to being exposed, to having mild symptoms, to being hospitalized, to being in the intensive care unit. And then what medicines doctors use along that spectrum of disease. Ideally, we want folks to get vaccinated, to not end up getting sick, to not end up getting into the hospital. That's on the far left with COVID-19 vaccines. The Omicron variant has knocked out several of our monoclonal antibodies. They're no longer effective against the Omicron variant. You can see those X's there where I've crossed out some of those monoclonal antibodies. They were used to keep people out of the hospital, to treat people who are at high risk from getting sick once they are infected from severe disease. So we have a couple new tools and then one tool that's left in our toolbox. So currently we have one monoclonal antibody that works against COVID-19. That's called sotrovimab. It's in very short supply in Calhoun County and the rest of Michigan, meaning your local hospitals have criteria on which patients they can be used on because it's in so short supply. And again, it's used to keep people out of the hospital. And then we have two new antiviral drugs or pills that are taken by mouth, Paxlovid, which is made by Pfizer, and molnupiravir, which is made by Merck. So let's talk about a little bit more about those. Next slide, please. So both of these pills are used for folks who have mild to moderate disease. So in other words, you're not on oxygen, you're not in the hospital. The idea is that those who are at risk for severe disease, to start you on the pills as soon as possible after diagnosis to then help prevent you from ending up in the hospital. And that's why testing is so important. The more we test, the sooner we can identify that you may be eligible to receive one of these medicines. And again, time is of the essence. They really got to be used in the first 5 days of symptom onset and ideally sooner than that. So Paxlovid is authorized for those who are 12 years and older and at severe risk for severe disease. You need a prescription from your doctor. Your doctor will look at your medication list because it has some drug interactions. And then there's also some medical condition limitations, kidney disease, for example, that may not allow you to receive the medication. However, it's in extremely low supply in Calhoun County and overall in the state of Michigan. And so that's a key point too, that there is criteria from the state of Michigan, and the state of Michigan allocates where this pill is available at this time. Currently not available in our local community yet. It has an efficacy similar to sotrovimab at keeping people out of the hospital and with severe disease. The next pill is molnupiravir. Again, it's used for those who have mild to moderate disease outside the hospital. It's authorized for those who are 18 years and older to prevent that severe disease. You need a prescription. It's got to be started within the first couple of days. But there's some unique things about this drug too. It has some unique information that your doctor will share with you if you are of reproductive age, male or female, for the doctor to discuss with you for how the how the antiviral pill works. It's available at all Meyer pharmacies right now, but it has a lower efficacy than Paxlovid or Lovid and Citromavab. So really, Citromavab and Paxlovid are the preferred medications, and if not available, your doctor may consider using Molnupiravir. And again, this is all based on whether you are eligible to receive the medication based on your doctor's assessment. So those are the new tools we have in our toolbox, and hopefully we have more supply in the coming weeks. I believe those are my slides for today.
Thank you, Doctor. Next up for our OSHA vaccine update is City Manager Rebecca Fleury.
Thanks, Chris. I appreciate that. Many of us that are considered large employers have been watching the OSHA vaccine information very carefully. But on Thursday, January 13th, the U.S. Supreme Court did put a hold on the OSHA ETS. This was the guidance that would require employees to get a COVID vaccine or weekly test for all employers with 100 or more employees. Certainly for many of us who watch some of those proceedings, or if you care to, there are recordings out there. The court did question whether OSHA had the authority to issue this type of emergency standard and applying that equally to all employees in all workplaces, instead thinking that Congress or individual states should have that particular power. As many court proceedings do, it has been sent back to a lower court. So the Sixth Circuit Court of Appeals, it has been sent back to them, and they will issue a decision. We get a lot of questions. When do you think that will be? Have no clue. It will have to work its way through Sixth Circuit, and we'll be continuing to watch that. Really, I think the message, the short version, is that the vaccination or weekly testing in large workplaces is on hold. Certainly for the city, we have collected the vaccine information for our employees, and we've also begun training employees on our policy requiring vaccination or weekly testing, but we will put that on hold until the courts determine what our next steps can or should be. Chris, that's all I have. Thanks.
All right, thank you. And on to comments from elected officials. Senator Bison.
Hi, everyone. This is Karen Todd in Senator Bison's office. I hope everyone can hear me okay. Regarding COVID-related news in the legislature, as you know, Senator Bison sits on Senate Appropriations, the committee, and coming down the pipe is what Senator calls a large healthcare budget supplemental bill. It's still being worked on at this point by committee members in the governor's office, but it is expected to be wrapped up in the first quarter of this year, resulting in funding coming back to Calhoun County. On the constituent side of business here in the office, unemployment continues to, we can continue to take calls and emails, but they have shifted from people in need of their UIA payments to now people have been receiving UIA notices of overpayment or misrepresentation. You may have heard some talk about that in the community from UIA constituents, and they're being asked to repay tens of thousands of dollars back to the state of Michigan, sometimes up to $20,000 that they received in UIA benefits between March of 2020 and September of 2021. And as you can imagine, this is extremely traumatizing for constituents. They called into the office just in a panic, getting this sort of mail, especially when they feel like they filed a legitimate claim and did not misrepresent their unemployment situation. So we can help navigate through the process of understanding why they received an overpayment and what they can do about it. There's a website that's very helpful too. It's attached to the michigan.gov/UIA website. And I'll post that here in just a minute. That explains why people are receiving the overpayment letters. It's most likely, excuse me, because under the federal PUA program, this was the program for people who were self-employed gig workers, and low wage earners. Those constituents filing for unemployment benefits could verify eligibility themselves for a time during the pandemic. But if the UIA could not determine that they had employment that was directly affected by the COVID-19 pandemic, or that their earned income supported an increased benefit amount, then their PUA claim could have been denied, leading to this overpayment notification that people are now receiving in the mail. So maybe you received a letter back in 2021 asking for proof of income or attesting to the fact that you were directly affected by the pandemic and possibly didn't respond to that letter. The UIA would have determined that you did not qualify, and now you're receiving the letter. So if you received an overpayment letter, or if you know anyone who did, they can follow the steps on their redetermination letter to protest their determination. Right now, protests are taking more than 30 days to get a response, sometimes even longer than that. If your protest is denied, you can appeal your protest. And finally, if that's denied, you can go before an administrative law judge to have your case heard. If all of those fail, you can apply for a hardship waiver. And all of the steps are spelled out on this webpage. And one additional thing, the UIA says that you cannot apply for a hardship waiver if you have an active protest. You have to wait until you get a determination from your protest before you can apply for your hardship waiver. I know that was a lot, but if you have any questions, I'd be happy to assist. And you can call the office. It's much quicker if you email, and I'll put that information in the chat as well. I think that's all I have. Thanks for the time.
Okay, thank you for the information. Do we have someone from Representative Hodsma's office today?
Hi, Chris. This is Jim Hodsma. Karen's outlined all the unemployment compensation issues that are relevant right now. Our office, additionally to Senator Bison's office, can also offer assistance. As most of you probably have heard, the State House of Representatives is not meeting in session this week. And at least in my case, my committees too aren't meeting. It's because of the coronavirus issue and the outbreak among staff and members of the House. I think it's really important that our legislature take up Open Meetings Act extension so that municipalities and townships and counties can meet virtually. I don't know when that will be taken up. That was not something we took up last week. It's in control of the majority party in relation to when that comes up, but it certainly seems surprising to me that we wouldn't be meeting in a state house context, and yet we would compel municipalities, townships, counties to meet in person presently. So hopefully we can get that taken care of soon. Thanks.
Okay, thank you, sir. How about Representative Hall's office? Any comments from county elected officials? Tribal elected officials? City of Battle Creek elected officials? Township or village elected officials? Hearing none, I would like to bring Eric Pessel back. He has some more information for us.
Thanks, Chris. Just one more thing I'd forgotten in my update, and I wanted everybody to know, and that is and actually Representative Hansma brought up kind of in the context of what I wanted to let everybody know, and that's what to expect over the next couple of weeks as we're going through this surge, and that is disruption to our lives. And we will see more and more, whether it's a meeting that gets canceled, whether it's school that has to go virtual just because they don't have enough staff to show up to be able to teach our kids, or we don't have enough students to be able to attend school to meet the 75% threshold that they need to get financed as an official day of school. And it's not because of a bunch of people out on quarantine. It's because we have a bunch of people out that are sick and a bunch of people that have tested positive. And so I just want everybody to understand that this is probably going to be for a couple more weeks. If this follows what it appears has happened both in Europe, the UK, South Africa, and maybe what we're seeing out east right now, we could expect a precipitous fall sometime end of this month, early February. And we might see things come back to more or be adjusted to a more norm. But right now, I think everybody just needs to understand there will be disruption in our lives. There might be our favorite restaurant that we want to go eat at. They don't have enough people to be able to stay open right now because they're all sick. Or it could be another business. Maybe it's a bank branch. Or like I said, it's school or a daycare. Expect more of that over the next couple of weeks, but we will get through this. It will happen and we'll get to the other side. But I just wanted to leave that note that don't be surprised if what you expected to be able to do tomorrow is canceled, and it has to do with the fact that we're surging with Omicron. Thanks, Chris.
Thank you, Eric. All good stuff. Next slide, please. Our best information sources are Calhoun County, City of Battle Creek, State of Michigan, and CDC websites. And for contact information, our JOC Public Information Officers, Lucy Blair, Victor, I apologize, I'm not even going to try, Jessica Vanderkolk. If nobody has anything else, we will adjourn this meeting, and thank you all for your attendance.